We got Matt Bellis coming up in a few minutes with Liberty HealthShare, my favorite company of all time in the healthcare world. And by the way, this segment brought to you by Liberty HealthShare. If you got hosed by Obamacare, like the Fräulein and I with a family of three, where our premiums went from $550 a month to $1,100, double, that's like 2x, $7,000 annual increase, and our deductible under Obamacare, get this, our deductible under Obamacare went from $500 to $8,000 a person, family of three, $8,000, not family, a person. So like all of us could have $7,999 of medical bills and not get a dime back. I mean, the whole Obamacare thing is just a redistribution of income scheme. And if you own a small business like me, or you're an independent contractor, you work on a 1099, or you work for a company like ours that doesn't offer, the Cadillac healthcare plans with, where you pay 30%, you don't work for the federal government, and you got hosed by Obamacare like we did, hosed, just killed, then your answer is right there, Liberty HealthShare. We've been on it since October last year, 12 months. Tell you guys, this is the greatest thing since sliced bread. Our premium went from $1,100 a month to $560. Okay, so we saved $540 a month. That allowed me to keep Joseph in Catholic school. I was going to have to take him out. I couldn't pay it. Unbelievable. It's the best thing out there. I just hand my doctor, Muscle Manny. We just took Joseph the other day, hand him the card. That's it. Boom. You get one free checkup, all that good stuff. My premium went down, but here's the thing with my deductible. It was $8,000 a person. That's absurd. I mean, that's catastrophic insurance. That's basically I was donating $1,100 a month to Obamacare. It was a donation. I got nothing. Now, my deductible is $1,500 for the family. So if I spend $1,500, Joseph spends $1,500, Ann spends $1,500, or we all spend $501 each, that's the deductible, not $8,000 a piece. I mean, Obamacare it's horrible. If you're in a position where you're forced into it, you're going to get killed. Now, let me tell you the other thing about Liberty HealthShare. It's in compliance with the law, so you can check the box. You're in full compliance. And it's like paying cash. You can choose your doctor. You can choose your hospital. You can choose anything you want. I mean, I go to Dr. Muscle Manny. That's my doctor. I go in there. I get my thing. I get my checkup, whatever it is. I hand him my card. That's it. No questions asked. Just hand him the card. I don't even fill out any paperwork. Here it is. That's it. Bye. See you next time. Thing is just fabulous. And if you know anybody that is caught in the Obamacare nightmare, or they don't have insurance because they simply can't pay it and they're not in compliance with the law, then you want to check them out. 855-585-4237. I mean, it's been a lifesaver for my family. I'm telling you. You got some friend out there that's getting hammered. 855-585-4237 or visit libertyhealthshare.org to request a free estimate. It's going to knock your socks off. libertyhealthshare.org. Speaking of Liberty HealthShare, we have Dale Bellis coming up in a few minutes. He's their communication director. This has now turned into one of my favorite companies. Matt, good to have you, man.
Thanks for having me.
Hey, listen, we were talking about Liberty HealthShare a little bit earlier. I just want to tell my callers again what a great experience it's been for my family and I. We've been on it, Matt, since October. I love your company. I just got to say it because you can choose your own doctor, choose your own hospital. I'll tell you the other thing. I love the fact that it's a shared service. Like the other day when we sent our premium in, family of three, $540, I believe, and pays, it shows you where the money goes. And it shows you that our premium was going to pay for someone else that had a health issue. And, it had like all the detail on it, which I thought was kind of neat because you don't feel like your money's just going into a slush fund, basically. Mm-hmm. So I like that. But the other thing, I don't have to pay for anything that I don't believe in, which is unique. Now, how did you get this to work under the Obama law?
Well, John, you're hitting the nail on the head when it comes to Liberty HealthShare and having shared beliefs that are commonly held amongst a group of people, and then sharing based upon those beliefs. And a lot of people have a hard time believing under the situation that we are in now with the ACA that this is something that is available to them, and it's available to them right now. It's not something that we're going to have to wait for Congress to vote on, or it's not something that we've got to wait for some bureaucrats in New York high-rise to come up with a program. This is something that's available to everybody right now, and we worked through the systems of the law to ensure that members of healthcare sharing ministries are exempt from the Affordable Care Act. It was something that we and others in the healthcare sharing ministry world saw coming down the pike and said, "Hey, we're a group of people that are self-sufficient. We need for nothing." And so we need to be exempt from the auspices of this law because we're not putting a burden on anyone. And actually, we are taking those burdens away from the general population at large.
And the thing I love about it is I don't have to pay for anything I don't want. So I'm a Catholic. I have certain religious beliefs. I say this all the time. I don't evangelize. It's not what I do, but I am who I am. But look, I was never comfortable paying for things that I don't think, God really wants me to get involved in, if you know what I'm saying, and without getting down that path. So I find it refreshing that I can be involved in something where that's not part of where my money goes. But the thing, just check it out. I mean, it's been a godsend for my family. I mean, look, if you work for the government or you work for a big company and you're getting the Cadillac plan and, they're paying 70% of it, you're in great shape. Stay with that. But if you're like me, if you're like an independent businessman or you don't have access to that type of Cadillac insurance, you're working for a small company, you work on a 1099, you're an independent contractor, you want to cover your family. I mean, Matt, we've been out for 12 months. I have had nothing but raving reviews and everything. And the thing I love about it is there's no paperwork, Matt. I'm not filling out form. I just go to my doctor. The other day, Ann took Joe to the doctor, his annual checkup, go in there, hand him the card. That's it. Done.
Yeah. Well, as a Christian organization, thank you for your rousing support for your Catholic views and being a part of a group of people who are faith-based. And that's actually a portion of why we're exempt, is because we are a healthcare sharing ministry. We're a Christian-based organization, and we accept as many people as we can. And as long as you agree with our shared beliefs, you're somebody who we want to work with. And so a portion of that Christian belief is that we make it available and affordable for all. And it's not available to people if they have to go to a doctor and try to explain everything or fill out a bunch of forms. And so we have taken the extra step to ensure that this is an easy, smooth process so that you can have an experience just like you had at the doctor, where you don't have to worry about whether or not your doctor is going to balk at this. I mean, sometimes we have doctors in place who aren't aware of healthcare sharing ministries, or they have their questions about it. We've set up an entire portion of our call center to handle our healthcare providers. We want them to be happy with the arrangements that they're getting into because we're empowering the patients. We're empowering the individuals to work with their doctor on a one-on-one basis, because we're in this arena. We're all self-pay patients who have gathered together to help each other pay its medical expenses. And so whenever a member goes to see the doctor is not having to deal with Liberty HealthShare. The doctor is having to deal with the patient. The patient is in charge. They make the decisions in consultation with their doctor. Sometimes there's a test that's not needed, and so the doctor won't prescribe those tests or a prescription that is unnecessary. It is the patient who is able to make those decisions, and not a bureaucrat somewhere else in some city far away.
Well, look, that's the bottom line there, is that the patients are making the decisions. But I just want to, so that our audience understands from my experience, the other thing you get with this, I mean, we got a $1,500 deductible for a family of three. All right. That means as soon as any of the three get to $1,500, we get 100% back. Okay. And when I was in Obamacare, I mean, Matt, it's just unbelievable. It was $8,000 a piece. So essentially, I could spend $24,000. I could spend $23,999 without getting reimbursed for anything technically. It was $8,000 a person. Now it's $1,500 for the family. But the other thing is you get your one free annual full checkup. All right. So, which includes, as a over 50-year-old male like me, I'm 58. You have to go through that. You get the blood test, the heart test, and you got to get the prostate cancer test, all that stuff. These are very expensive. You get that for free because Liberty HealthShare believes in preventive medicine. So, again, I just hand him my card. That's it. When I was under these other insurance plans, you'd hand them the card, you'd get a bill, they wouldn't pay all of it, you'd be fighting. Ann would be on the phone fighting with the insurance company. How come you only covered 70%? Everybody's had these experiences. We don't get that with Liberty Share. I hand them the card, that's it. I don't even get anything in the mail. Done.
Yeah.
How do you do it?
We take the standpoint of, frankly, what is the most loving thing to do? Because we are a Christian-based organization, we are compelled to provide what is most loving and what is most charitable to our fellow man. And it's you have a system or a program in place that is not even like having those bills taken care of in the first place. It's not very loving whenever you have to fight with somebody to get something taken care of. And we're a group that says, we're going to try and make sure that for all those things that are unexpected and unaffordable, we're going to be behind you 100%. And for those things that you can do on a regular basis to ensure that you are in good health, we're as a community going to share in those expenses. It's not free. I heard you say free. It's not free. It's something that we as a community said we want John to be as healthy as possible. John needs to go in for his checkup and make sure that he is healthy. And so that's something that that expense of him going to his doctor, we're going to share in that expense. So these are groups. This is a group of people who is committed to one another. The contract of help, it resides in our hearts. And so we come to each other and help each other in the most loving way possible.
I tell you what, I love that explanation. More information, 855-585-4237. Tell them John sent you. 855-585-4237, or visit libertyhealthshare.org to request a free estimate. We're with their communications director at libertyhealthshare.org, Matt Bellis. Matt, let me just ask you this. I got a text here from one of our listeners says, do they offer dental and vision? I know that we have dental through your company. I don't know how it works. I've only got a minute. How does it work?
Yeah. So there are, like I said before, we're here for those things that are unexpected and unaffordable. A lot of times, dental, if it's not associated with a medical incident, is not something that we would share in. But again, we say we're going to help find the best ways to decrease those costs as much as possible. And so, as a Liberty HealthShare member, you are enrolled in a program that we have called SaveNet. And so you're able to discount your dental and vision and other necessary items that go along with your health on a deep discount basis. And so we have those systems in place to help you pay for those things, because those are things that, we can plan for and be responsible for and take personal ownership of. And so we're here for those things that you can't plan for and aren't affordable. But those things that are, we're going to do the extra steps to ensure that we're not a burden on the rest of the community.
Let me just tell my audience, if you got hosed by Obamacare like we were, and it's just nailing your family financially, and you're just unhappy with the whole thing, there's no periods for enrollment. You can just go now. Just check it out. I tell you what, take you 5 minutes, go to libertyhealthshare.org to request a free estimate. It's going to knock your socks off. In fact, you're going to think it's a typo. Go to libertyhealthshare.org to request a free estimate, or call them 855-585-4237. Matt, thanks for being with us, man. I'm out of time.
John, thank you so much for being a member.
Keep up the good work. This is the John Fredericks Radio Network.